So why is this needed? Unfortunately, as I'm sure anyone who's experienced modern healthcare can attest, traditional medical training is really prioritizing efficiency and hierarchy. And that has to do with a lot of reasons. Part of it is there's limited resources and in healthcare, limited numbers of doctors and nurses and other healthcare professionals, and there's a lot of patients. And so we need to try to distribute those resources in the best possible way to help the people that need help get the help that they need. And that's challenging, especially in a modern climate, and when payment is an issue and all of that. And then there's also hierarchy, and some of that is appropriate, right? Sometimes there is a legal hierarchy that we follow in terms of, a doctor is providing an order that another healthcare professional is maybe carrying out, and that has to do with the different levels of training of those professionals. But it also goes the other way. Other healthcare professionals may have an experience or an observation about a patient that they need to bring back to the doctor and feel confident saying, hey, I know you ordered this. This is what I'm seeing in the patient, and I need to just let you know that to double check that this is actually still what you think is the right call. And so some of the hierarchy is legal, some of it has to do with training, but always it should go both ways. But unfortunately, because of, particularly in the US, the legal structure and malpractice and just laws that govern different areas of practice of medicine, the hierarchy and the efficiency can kind of take precedence over empathy and the human connection with the patient. And so the way that plays out is often we ended up rushing through things that can be pretty sensitive topics. So you may come up with it to a patient just going through a medical history, and to the doctor, it may seem just like one more thing on the list to check off, but to the patient, it reactivates a really painful memory or brings up a really sensitive discussion that they're really not ready to have in that moment. And that can be really hard for the patient to then feel safe and comfortable continuing with the rest of the exam. The other thing that often happens too is there's sort of this assumption that like, oh, well, you're here, so you want us to help you, so you're just going to do all the things we recommend. And that's just not the case. That's not to say that the patient won't choose to consent to something once you give them all the information, but you can't assume upfront that they're going to do everything that you ask of them. And you can't then say, well, I'm not going to care for you if you don't do all of the things that I ask of you, because that also reduces that safety and that trustworthiness and that collaboration and empowerment and choice. So it is really important for us to be able to take into account that the patient has the right to choose, and we should never assume consent. And we need to give them all of the relevant information so that they can make the right choice.